Greetings, teacher and students. My name is Colin. I am a health ambassador working in the hospital authority. Today I will share about cholera and liver cancer. Let's begin. So the causative agent for cholera is called fibrocholerae, which you can see in the left-hand side is a fibrocholerae strains observed under the electron microscope. There are many cell groups of fibrocholerae, but only two, O1 and O139, cause outbreaks of cholera. Phi cholerae O1 has caused all recent outbreaks, according to the World Health Organization, and Phi cholerae O139 recently has only been identified as sporadic cases, which meaning it has never been identified outside a certain region, in this case Asia. There is no difference in the illness caused by the two cell groups according to the World Health Organization. So the symptom of cholera is the most observable symptom of cholera is cholera-related diarrhea, which you can observe is rice water stool, which includes flecks of mucus and has a fishy odor. And it usually appears within a few days of infection, which meaning 2 to 3 days of infection. It can develop more serious symptoms of cholera and cause mild or severe dehydration. It often has a pale, milky appearance that resembles water in which rice has been rinsed. So as you can see, the upper left-hand side is rice water stool, and the lower left-hand side is water that has been used to rinse the rice. So you can see the color resembles rice water. So now we're going to talk about dehydration, which is developed within hours after cholera symptoms start and range from mild to severe, which includes irritability, fatigue, sunken eyes, a dry mouth, extreme thirst, dry and shivered skin that's slow to bounce back when pinched into a fold, little or no urinating, blood pressure which is very low, and an irregular heartbeat, which is either too fast or too slow. A loss of 10% or more of body weight indicates severe dehydration. And nausea and vomiting additionally contributes also to the dehydration, which is also a symptom of cholera. So as you can see in picture C, this is a woman that has infected cholera. And as you can see, fatigue in her face, you can see she looks very tired. Sunken eyes, yeah, you can see it, the comparison in picture C and D. A dry mouth, which is observable, you can see her lips, and dry skin. You can see her skin is almost sunken. And in picture D is after the patient which infected cholera rehydrate herself, which this treatment is called hydration therapy or just hydration treatment. So the way of transmission of cholera is through food and water. The fibrocholerae infection is primarily acquired by ingesting contaminated food or water. So in endemic regions, Phi cholerae in the water are part of an important reservoir of the organism because Phi cholerae can live on chitinous plankton, which is a kind of plankton, which plankton is living things living in water. So in the picture in the right hand side corner, you can see the fibrocholerae exists in the infected or infested water region, which people use to obtain the water to either cook or drink, which in a way they ingest the contaminated food and water, and then upon ingestion, the toxigenic strains colonize the small intestine, which lead to which lead to infection of cholera. So this individual, as you can see in this picture, fell ill and has secreted diarrhea shed of water stool, and then people will just keep this a infection cycle, which they deposit the waste back to some river, and people obtain water from that contaminated river, and then they ingest the contaminated food or water which is used from the contaminated river or region of water, and then they causes outbreaks of cholera in this way, which this is called an infection cycle in this case for cholera. So, however, direct person-to-person transmission is also thought to play a role in transmission. So organisms that were recently shed from infected individuals appear to be transiently more infectious than organisms isolated from the aquatic environment. So mathematical models actually suggest that person-to-person transmission of human-shared hyperinfectious V. cholerae is essential for the rapid propagation of cholera that is observed during epidemics. So as an example in the right hand side corner, so if someone touched their hands to the infested or contaminated water, and then shake your hands, and then if you lick your hands or maybe you eat your fingers, you will get infected. Maybe you're eating chips, I don't know. So basically that's so person to person transmission is rare, but it could happen. So this is a few prevention methods of cholera, which includes washing hands with soap and water frequently and thoroughly, especially after using a toilet or before handling food. Rub it with soap and wet hands for at least 15 seconds before rinsing. And if you don't have access to soap and water, you can use an alcohol-based hand sanitizer, and you should drink only safe water, and the definition of safe water is bottled water or water which you have boiled for at least 1 to 2 minutes. So use bottled water to brush your teeth if you live in contaminated regions, and eat food that is completely cooked thoroughly. So in the right hand side you can see this is a poster officialed by the World Health Organization or Regional Office for Africa, which basically tells you how to cook your food thoroughly to ensure food safety. You can also prevent cholera by intaking the cholera vaccines. So basically now currently there are 3 World Health Organization pre-qualified oral cholera vaccines: Ducroy, Santroy, and Ufectroy Plus. These 3 types of cholera oral vaccines require 3 doses to its maximum effect. And severe other countries offer oral vaccines as well, such as the US government, which the US Food and Drug Administration has approved of Cholera, which is lyophilized CVD103 HGR. It suggests for people between ages 2 to 64 who plan to travel where cholera is being spread or regularly spread is a liquid dose taken by mouth at least 10 days before travel. So as you can see in the right hand side, this picture, you can see children being fed the cholera vaccines. So now I'm gonna talk about the first line of defense against pathogens of cholera. So, an example, in individuals with no prior exposure, innate immunity provides the first line of defense against cholera. The bacteria must survive passage through the acidic environment of the stomach, which include gastric juice, which kill most of the cholera bacteria and virus. And the fibrocholerae must penetrate the mucus layer of the small intestine to reach the crabs, which will lead to infection of cholera. So this is a photo showing the immune response to cholera. So if you're lucky enough to obtain a vaccine, or you have recovered from cholera yourself, you can see the antigen going through the price patches to the mesenteric lymph nodes and through the thyroid duct, and through blood circulation it will eventually reaches the plasma cell, which creates antibodies to fight back against the infection. So how do you get infected is the free cholera in this case survives the gastric juice and the acidic environment of the stomach and colonizes the crab epithelium, multiplies and aggravates, and produces cholera toxin. In response, mucosal host defense proteins and oxidases are expressed at the epithelial surface, and cytokine pathway recruit immune cells to lamina propria, including lymphocytes. But however, it's a meaningless endeavor because you're already infected, because the free cholera already colonizes your entire colon, so you will get infected anyway. So this is the citations for cholera research. So next I'm going to talk about liver cancer, which is a non-infectious disease, unlike cholera. What is liver cancer? Cancer that originated from the liver cells is liver cancer, not cancer that spreads to the liver. So for example, if the cancer started in your colon and then spread to the liver, it would be called metastatic colon cancer, not liver cancer. So what is the main type of primary liver cancer? The most common type of primary liver cancer tumor is hepatocellular carcinoma, which is a type of liver cancer. So the symptom of liver cancer from the early stage is not very observable. So most observable or symptoms includes abdominal swelling, which makes you lose appetite and eventually contributes to losing weight without trying, and upper abdominal pain because you have accumulated enough tissue fluid, and nausea and vomiting, which also contributes to the loss of appetite and losing weight, and general weakness and fatigue because of abdominal swelling and abdominal pain, and jaundice, which is, as you can see in the right hand side, both the upper and the lower right hand side picture with yellow hands and the yellow eyes, that is jaundice, which meant the yellow discoloration of your skin and whites of your eyes, which is called jaundice. So the risk factors for liver cancer includes chronic infection with hepatitis B or hepatitis C virus, and cirrhosis, as you can see in the picture in the lower left, and certain inherited liver disease, and just family history, or you inherited carcinogenic genes, you have diabetes, obesity, non-alcoholic fatty liver disease, exposure to aflatoxins, which you can see in the upper left picture here. This aflatoxin, which exists in vegetables, with which maybe you ingest the aflatoxins in some way. Maybe you eat the aflatoxin susceptible food, maybe nuts and corn, or maybe you just, in some way you ingest the aflatoxin as food. So it's human consumption risk. So and excessive alcohol consumption. So now I'm going to talk about how healthy lifestyles can help prevent the disease. So drink alcohol in moderation if you drink alcohol. So of course the best case is that you don't drink at all. So maintain a healthy weight by doing exercise. And the definition of doing exercise is just maybe you can even jogging is also counted as exercise. Even walking is an exercise. So be more movable, and you should know the health status of any sexual partner, and you should also practice safe sex, which your partner or you yourself use condoms, and don't use IV drugs, but if you do, use a clean needle, which in the left hand side middle corner you can see a man injecting drugs. But remember to use a clean needle if you need to use drugs for some reason. And also, like vaccination, don't go to a shady clinic for vaccination, and ensure that they use clean needles. And same as seeking safe and clean shops when getting a piercing or tattoo. Needles that may not be properly sterilized can spread the hepatitis C virus. So another prevention methods of liver cancer is receiving the hepatitis B vaccination. So prior to hepatitis C have no vaccination. So all you can do to prevent hepatitis C, which may eventually lead to liver cancer, is to use a clean needle. So unlike hepatitis B, which also lead to liver cancer, you can prevent it by receiving the hepatitis B vaccines. And this is the citations of the liver cancer research. Thank you.